Hi folks, I'm Laird Landon. This is the second segment designed for professionals to talk about how they can better help family caregivers. In the last segment, we discussed grief, both anticipatory and ambiguous grief, and we talked about the caregiver burden and possibly caregiver burnout that can happen after the long journey as a caregiver. I'd like to start this segment by going through what my co-author and I consider 6 different phases that caregivers go through. Not every caregiver goes through every phase in the same order, but these are major high points in the journey. These points are discussed in our book, Caregiving, Journey to a New Horizon. It's available on Amazon. It's by Henshaw and Landon. I've discussed these also in previous YouTube episodes in this channel. The first phase is to realize. The caregiver must come to realize there is a life-changing event that is happening. This obviously happens at diagnosis. When a neurologist tells you there's a neurological disease that is very long-term and will eventually take your loved one's life, that shatters your world. Your life will never be the same. But it's also important to realize some people don't ever get a diagnosis. If it's an older person, like a parent who is in their 80s, you may just assume that this kind of mental lapse is just a normal consequence of age. But you still carry the burden of caring, and at some point you realize this isn't going to get better. The second phase is when the caregiver makes commitment. They make commitment to take care of this loved one. Many possible reasons: love, marriage vows, drawing the short straw with the family members. But this is when the caregiver says, I can handle this. And they put on the backpack. It's important for you to understand why your caregiver is doing this. And we'll discuss this in a moment. The third step is when the caregiver realizes, for all their good intent, they no longer can do everything themselves that is necessary. No one can care for someone else 24 hours a day. But initially we think we can. And even as we dig more into exhaustion, we may think we can do it, nobody else can. But at some point, you raise your hand and say, I need help. This is when we look outside for resources, neighbors, family, home care, home medical care. Even hospice could occur at this point. Not only do you need help, but you need professional help, because you can't do it anymore, and their requirements for daily living are something you can no longer do. This is when you say, we both need help, and you delegate. The next step, after you've delegated, after your person is placed, maybe in hospice, maybe in memory care, maybe in a nursing home, maybe even in independent living, others are providing most of the daily care, but you're not out of the picture. You're still an advocate. You are the one who is responsible overall for the care. You know your loved one better than anyone else. You can educate them as to what they are doing. And so they know who that person is and how best to care from them. You advise and protect. The final stage is after your loved one dies. You then grieve. And you grieve more than you did before, even anticipatory or with an ambiguous grief. What you're doing now is grieving for their death. You must remember who they were, what they meant to you in your life, and adjust to your new life without them. Let's talk about what you can do to help your patient and the family caregiver realize what's in store. I told you that the diagnosis was the most traumatic and the most grief-filled episode for me in my 10 years of caring. Realize that the family caregiver and probably the patient are in shock. Their planned future is gone. There's no more retirement. There's no longer the need to be able to stay in the home forever. And when anyone is in a case like that, they can't process too much. So keep it short and sweet, please. If they ask, if you want to discuss the general progression of the disease, go ahead. But if they feel like they're not handling it, if you can tell they're not handling it, please just move right on. You might suggest to the family caregiver a counselor, because counselors can help us deal with the major transitions and shocks in our lives. Invite them to come back when they have more questions. Create a relationship with the family caregiver that you are a source of help and information and comfort. Don't focus completely on the patient. Let that caregiver know they can call you later. And a final idea, make a commitment to yourself to call that family caregiver in a couple of weeks and check in, saying, I just want to see how you're doing. And I guarantee they're not doing well. And you can listen to them. You can make them feel less alone. Being a caregiver is extremely isolating, and the disease all of a sudden separates the caregiver and the loved one with everyone else. The second stage in caregiving is to commit. And you can help with commitment, because commitment often flags. People don't get sleep. People are frustrated. People think they can fix the disease when they can't. But you might ask them a question on another visit or a phone call. How do you find the strength to carry on? What they may do is tell you a story of why they love this person, what that person did for them a long time ago, and because of that, they are committed to caring for them. That's lovely. It reinforces why they are committed. You might also ask, how do you find time for yourself? This is a raw nerve for many caregivers, and you have to tread lightly here. Everybody says, take care of yourself. A lot of the family, all other friends in the neighborhood will say, now be sure you take care of yourself, and that often makes us caregivers angry. Oh, I'd love to. I'd love to go for a run, but when do I have time? I'd love to get my hair done, but I can't leave him alone. This is a sore point. But when you ask the question, how do you find time to take care of yourself? If they say, I really don't get to, you can introduce the notion that on an airplane, we're instructed to put on the oxygen mask first before we care for our infant child. Why? If we pass out, we can't help anybody. Same thing for caregivers. And you can introduce that notion, give them some suggestions on how they can proceed. Finally, you can reinforce the value of caregiving by saying, you are doing everything you can. And that's enough. You can only do what you can do, and you can't bring them back to where they were. You may also reinforce what they're doing for the loved one. Suggest, you know, what you're doing for your mom really is necessary for her, and she's pleased whether she can express it or not. The third stage that most caregivers go through in their long journey is they do reach a point when they realize they can't do it all and they reach out for help. The difficulty is caregivers don't know who to reach out to. They don't know where the social resources are in the community. And if you know something about what they are, you can assist them by referring them. Many professional caregivers who don't understand exactly what those resources are can't very well help. The first one I want to talk about are support groups, because they provide real help for caregivers, primarily in the area of reducing social isolation. Your friends, your family, they don't really know what you're going through. You're all alone. You don't get out of the house as much as you would like. If you walk into a support group of other caregivers and find out they get it, they know what's going on with you, you feel immediately less isolated. In addition, they provide emotional support, and by listening to their stories of how they've coped, the caregiver you're treating can learn how to cope as well. Social workers, licensed clinical social workers, very valuable at this time, not just for the day-to-day, how do I get through the day, but for really understanding how the arc of your life has been interrupted and where it's going. Neighbors, family, and churches can give some respite, but you know, caregivers often feel they're the only ones that understand. Mom won't listen to anybody else. My husband won't let anybody in the door. And they say that to you. They say, I don't want them coming over. Maybe they're embarrassed. Maybe they don't like to be bothered. But we need respite. If you have a friend in the neighborhood who can come and stay with mom for a couple of hours, you can get out of the house. You can get your hair done. You can go for a walk. And please avoid this one mistake that many caregivers make. The minute somebody's occupying mom, caregivers take their time to clean up the mess they couldn't clean up before. But that leaves you even more tired than you would be. Respite means getting away and having some time for yourself. Home care is the name of the term for organizations that provide people to come into the home, help clean the home, help care for the loved one for minor issues that they need. They can cook. They can even grocery shop for you. Valuable resource. It's available. It isn't terribly expensive if you limit the number of hours that you use. Finally, I suggest that all of you become familiar with the Area Agency on Aging. This is the organization that is federally supported and supported in your state to provide care for seniors. It was the Lyndon Johnson Act in the mid-60s that was designed to provide care for seniors. And they have a list of references and tools that can help family caregivers. Please find that number and have a phone number available to give caregivers. The fourth step is delegation. This is when someone else, in my opinion, takes over the primary care of your loved one. It doesn't mean you're out of the picture. It has to do with terms that we don't like placement, like hospice, like putting them somewhere outside of the home. Many of us are able to care for our loved ones at home, but most of us are finding in this day and age it's difficult. We don't want to do it because it means admitting we can't do it all and we want to. We don't want to do it because we remember our grandparents telling us some horrible stories and begging us when they were 50, don't ever put me in a home. But you know, it may be what is best for your loved one and for you. In order to help them with that and all that resistance they get, one idea I have is to not focus on placement, but focus on the long-term care needs of the loved one. They will get to a point where they can't take care of themselves. They will get to a point where they need medical monitoring on a regular basis. They will get to the point where they need professionals to help administer solutions. If you can imagine the future a long way away, it will prepare them that this day will come, even if they can't accept it right now. Another thing to do here is not just talk about what they will need, but talk about what the benefits of placement are. What happens when your husband is placed in a memory care unit? What is a memory care unit like? How are they run? What do they do for the patient? What do they do for you? If they're educated into what to expect, it will be a little easier for them to accept it and want to move on. You might even suggest, and I like this, when you see that they are getting close to needing this, even if they don't recognize it, recommend that they start looking at the facilities. You might begin by saying, I know, you're not ready for it yet, but you will be someday, and it could happen in an emergency. If your husband with Parkinson's falls, goes to the emergency room, he's going to be placed from the hospital directly, and you don't even know where they're going to be placed. So let's do a little bit of homework and learn what the facilities are that might treat your husband with Parkinson's, so you have a choice, so you are in control of the decision. The next stage, you are an advocate after placement. We were just talking about learning about placement in the future. Now placement has happened, either hospice, memory care, assisted living. Your job doesn't end. Part of our regret, part of our guilt for having to go to that stage of letting someone else have primary care of our loved one is that we feel we failed, we've lost, we're out of the picture. We're not out of the picture. You are still an important part of the team, and act like a team member. Praise people. Give them some education about your loved one and what they like and what they don't like, so that they will treat them automatically with the kind of care you think is necessary. Don't just wait for them to make a mistake and then correct them and get angry. If you misbehave, they will treat you like part of the problem, not part of the solution. Care conferences are very important, and I want to talk to you about them. Many of us never experience them until after they've placed their loved one. These are required meetings with the family, caregiver, and the staff of the facility. In many states, they're required on a quarterly basis. You have the right to request a caregiver conference if you've got an issue you want to address. What happens in these meetings usually is there is a person who's in charge of each department that serves your loved one. There is the caregiver in the unit. There is the medical professional who talks about medication. There is the dietitian who talks about how much they're eating. There may be somebody from hospice to see if you have any needs as well. When you go to these caregiver conferences, again, use praise for what you like. Tell them what you have witnessed that you appreciate. If you have questions about how they do something, ask the questions. They'll tell you then. If you do have a concern about something that you don't think was done right, bring that up too. If you as a caregiver are involved in the care conference, it will be much more effective than if you sit passively and just let them go around the table. Finally, the long journey seems to be over because your loved one dies. This is not the end of the journey. There is grief and continuing on with life. I want to talk to you about how differently caregivers grieve from other people, the way society thinks they should grieve. If you know these things, it may help you provide comfort and not add to the burden of the caregiver who doesn't understand why they feel the way they do. Most important thing we say to everyone who counsels on grief is make sure the person understands they should grieve in their own way. Friendly, helpful neighbors who tell you how they grieved, tell you how somebody else grieved, tell you how you should grieve, are not to be listened to. Grief is one of the most personal and emotional experiences humans have, and it must respond to your own needs and your own relationship to the loved one, and no one else can tell you how to do it. Encourage people to do it in their own way. It turns out caregivers, after they lose their loved one, actually sleep better and want to go out and party a lot sooner than other people think they should. You see, caregiving is so long towards the end of life. The caregiver is wondering, there's no quality of life here. This person is in pain and discomfort all the time. They can't taste food. They can't hear. They can't speak anymore. What is the point? And I've been doing this so long and grieving all the way along the way that the dominant emotion that most caregivers feel when they lose their loved one is relief. Hard to believe, isn't it? They are released from the burden of caregiving, and their loved one is relieved from the burden of slowly dying. People automatically feel guilty about this, don't they? You know, you can't tell your neighbor, boy, am I glad it's over. That looks disrespectful. Very few people would understand that. Also, this business of wanting to go out and be social, you know, in the 1800s, women who were widows were supposed to wear black and stay indoors for a year. If they were good, at the end of the year, for the next year, they could wear purple and go out to lunch with their female friends only. Well, we're a long way away from that. The truth is there's some socially acceptable time you should stay at home, but then it's okay to re-engage. There are other people who try to drag you out because they think you're just moping around the house and need to get started again. Again, leave those people alone. But it is not uncommon for caregivers to open the windows, let the world in, and want to re-engage. This can cause pushback. One of my favorite stories that I've told on a previous episode is a fellow cared for his wife of MS for 22 years before she died. After she died, he wanted to go out again, and he did. And 9 months later, he found someone he wanted to marry. He told his friends. His friends said, "Oh no, you can't do that. You're making a mistake. You haven't grieved enough. It's too soon. You're reacting emotionally." Do you hear that? He was a strong guy. You know what he said? He said, "What? 22 years isn't enough?" The point is, what we experience all along the way puts us in a different place than many people are. Finally, I want to say caregivers often delay summing up. This was the case for me. By summing up, I mean kind of going back and reflecting on where you've been. Reflecting on the time you spent with your wife or your parents. Remembering the early days. Remember falling in love. Because you want to bring those things with you. You don't want them to be forgotten. But often caregivers delay that process. For example, many grief group processes involve the caregivers bringing in a picture of their loved one and then discussing the picture and what it meant to help them sum up, to help them remember. I find that with caregivers of long-term terminal illnesses, some may want to delay doing that. They don't want to look at the picture. In my own case, I thought that was probably because most of my recent memories of my wife were not happy ones. She was dying. She weighed 80 pounds when she died. She couldn't speak. And I was living that with her. And the minute it was over, I just wasn't in the process of reviewing our wedding album. I did eventually at the 1-year anniversary. And in some religions, the 1-year anniversary of a death is an important time to review. For me, it worked. So you see, there are many differences, and if you're aware of these, when you have a caregiver that you are treating, that you are in touch with, you can be a little bit more tuned into where they are. You can normalize their own feelings and say, you're doing this your own way at your own time. Thank you very much.